Hey guys, welcome to Module 2, Cardiovascular Emergencies. In this module, we're going to talk about how to recognize a cardiovascular emergency and what to do in these situations. So let's begin. First off, we need to know what is the cardiovascular system. We can simply think of it as a system of fluids, pipes, and a pump in our body. We have the heart, which pumps blood to supply nutrients throughout the body through a network of blood vessels. All three parts of the system is crucial, and if one of them malfunctions, this could potentially lead to what is called shock, which is when the body has insufficient blood and oxygen supply to the bodily tissues and vital organs. Causes of shock include blood loss, nausea, vomiting, and diarrhea, which cause a decrease in fluid levels in blood. Burns and allergic shock can impair the functions of blood vessels, ceasing blood flow to supply vital organs. As well, spinal cord trauma and heart attack affects the ability for the heart to pump blood around the body, leading to shock. So how do we know if someone is going into shock? Well, we can potentially see a loss of consciousness, cold, pale, sweaty skin, blue or gray lips, nausea, vomiting, a fast pulse, and rapid, shallow breathing. By recognizing these signs, we can then apply the appropriate treatment, which involves treating the life-threatening injuries first, such as the lack of breathing or lack of heart rate. We can place the injured person in an appropriate position to treat shock and place a blanket to keep them warm. Always treat for shock for all emergency situations. Shock requires immediate attention, and if not treated, the chance of survival becomes minimal. Now, what are the appropriate positions to treat shock? It will depend on the situation at hand. If the injured is suspect of a spinal injury, leave them in the position found unless any life-threatening injuries require you to move them. For persons with difficulty breathing, place them in a semi-sitting position with their knees bent. The recovery position is appropriate for the unconscious or an extremely ill person. And lastly, the supine position is best for the conscious and ill. Take each emergency situation into consideration before deciding which position is most appropriate. Moving on to heart attack, which is also known as a myocardial infarction. This occurs when there is a complete blockage in the coronary artery that supplies to the heart. This leads to the part of the tissue to die, causing the heart to stop functioning properly. To recognize a heart attack, we can use the mnemonic "Pass It On," which stands for paleness, anxiety, shortness of breath, sweating, indigestion, tightness in chest, overall weakness, and nausea. Recognizing these signs and symptoms are crucial because the longer it takes to treat these symptoms, the poorer the expected outcomes after treatment. However, sometimes recognizing a heart attack gets less intuitive. In women, diabetics, and people over 70, they may not experience any chest pain at all. They may have toothaches and maybe even feel mild symptoms which they may ignore. It is important to recognize that they may be in denial and refusing to go seek medical attention. When handling these situations, call 911. Don't wait or hesitate. Seek medical attention before it's too late. Monitor their airway, breathing, and circulation. Apply CPR and AED if they suddenly go into cardiac arrest. Assist them into a comfortable position and loosen any tight clothing. Assist the person with medication such as aspirin if they are prescribed. Ensure that they only take one regular dose as instructed. In a related situation, angina is chest pain that can occur due to insufficient blood supply to the cardiac muscles, as opposed to a complete blockage in a heart attack. This can be caused by physical activity, exposure to cold, or stress. To treat angina, as first aiders, we should monitor their airway, breathing, and circulation. We should recognize that the chest pain is similar to a heart attack, but this should not last more than 10 minutes and should stop with rest or medication. If the person is prescribed, assist them with nitroglycerin. Ensure that they take only one dose every 5 minutes for a maximum of 3 doses. Nitroglycerin comes in a spray bottle or pill. Seek medical attention if symptoms last for more than 10 minutes, as this may be indicative of a heart attack. Now that we've talked about assisting with medication with our last two medical conditions, it is important to step back and talk about our role as first aiders. As first aiders, we must follow the 5 rights of medication administration. We must make sure that the injured person is taking the right drug, that the medication is for the right person, with the right dose, through the right route, at the right time. It is important to remember that we are here to assist the person with the medication. Ultimately, it is the person's choice whether they want to take the medication or not. First aiders should never force or coerce people into taking medication. We should only assist when instructed by the 911 call, if the ill person requests, or if requested by parents or guardians for children. Not only is our heart a vital organ, our brain is also important for survival as well. This is why strokes, where blood supply to the brain is cut off, requires immediate medical attention. There are 2 types of strokes: ischemic, where embolic blockage occurs in the arteries supplying to the brain, and hemorrhagic, which occurs when there is a rupture in blood vessels which cause blood loss. In the same pathophysiology, a transient ischemic attack is a temporary blockage in blood supply. However, it is important to note that those who experiences TIAs are more likely to develop into a stroke. Since strokes are so lethal, first aiders must recognize the signs and symptoms, which include headaches, drooling, numbness, and confusion. Sometimes these signs and symptoms are not obvious, and so first aiders use the mnemonic FAST. FAST stands for face, arms, speech, and time. Ask the person to smile. Does their face droop? Ask the person to raise both arms. Does one side lower in weakness? Ask them to repeat a simple sentence. Are the words slurred or unclear? We must lastly keep track of time and get them to medical aid as soon as possible. Every minute loss means a 10% decrease in the chance of survival. Our last medical condition that we will cover is syncope or fainting, which is a temporary loss of consciousness from decreased blood or oxygen to the brain. Fainting can be caused by vasovagal situations from stress and anxiety. It can happen in diabetic emergencies, anemic situations where oxygen supply is decreased. Dehydration can also cause a decrease in fluid levels, which decreases blood volume. Lastly, a decreased blood supply to the brain can be due to a cardiac pump failure. To care for fainting, airway, breathing, and circulation is crucial. It is also crucial to monitor the person's condition as well. Call 911 if there are repeated episodes of fainting, if the cause is unknown, if they are elderly, linked to an injury or medical condition, or if the person doesn't regain consciousness within seconds, not minutes, seconds. First aiders should place the person in supine, cover with blanket, and provide continued care until medical aid arrives. And this is the end of Module 2. With our understanding of cardiovascular medical conditions, we can now move on to provide the appropriate first aid to those in need, giving life a last stand, second chance. Thanks for learning.